think the next one is you, yes. So I would like to introduce Professor Merim. I think he will talk about hijama in Balkan. Yes, please.
Thank you very much for introducing each other. Thank you for your presentation. I'll try to do it briefly, more briefly than you, because all of us become tired. Yes.
Extended.
I'll start in our region. Hijama and bloodletting therapy, as you have seen from my historical review, was always a medical method, and it was described in our medical encyclopedia, which was published by former Yugoslavia Academy of Science, and as medical method. So by our law, for any traditional methods or any methods must be done by doctors and by doctors, medical medicine or stomatology. I'm practicing acupuncture for over the 30 years, and it is traditional Chinese medicine. But I met hijama which was doing on my visit in Saudi Arabia. I was fond of marks of hijama, which were performed on some of our Hajj leaders of our Hajj, and I was wondering what it was, and I have chance to see it. And in 2003, after 2 years searching for medical explanation, I start to working. At that time, there was no literature about hijama. The excellent book, which was published in Syria by Syrian doctors, they were following Emin Sheikhu, their scholar from 19th century. They explain in very nice way, logic and scientifically medical way. They explained how some of our opinions, how hijama could work, possibly effects, possible mechanism of action. So I followed their advice to try to do hijama on the neck and on 2 places between scapulas. It was a very simplest method, and in medicine, we start from simple and then made more and more complicated or advanced treatments. And I was amazed how it acts on it acts like preventive medicine. It acts like treatment for stage of non-health condition. As Professor Pischinger said, it is something non-health, something between health and disease condition when we are not ill, but we don't feel well. And it is reversible state. After that, difficulties become more serious, and the chronic disease come. Before starting to perform hijama in serious way, I made a scientific meeting. In one place, there were scholars. Our professor of hadith in Islamic faculty, he helped me with proven Sahih hadith on hijama, so we can start from tradition. And then professors who work in faculties of biomedicine tried to explain some possible mechanism and to explain how we understand in that moment some of the effects of hijama. It was so professor of neurology, she sent regards, she couldn't come again here, to speak about headaches, because in one hadith we had proven hadith that it is said that our Prophet ﷺ underwent hijama after he had headache. Professor Jasminka Jelilović speak about headaches, and in this past period, in these 16 years, we have some 254 severe headaches which improved after hijama treatment, a lot or complete improvement after that treatment, and it is statistically significant number. It is interesting that also sending to us his regards, Professor Ljubo Ristovski, who is professor of biophysics of pharmaceutical faculty in Belgrade. He speak about hijama in that time from his point of view, mechanism of actions of hijama, and said that hijama is, by his opinion, the most alternative medical treatment, as he knows. So why? Because from few places, all body can be activated and get results in improvement. From other point of his view, the circulunar rhythm was neglected or never explained, never introduced in alternative medical system. But our prophet speak about and recommend to perform hijama in third quarter of lunar cycle. So circulunar rhythm is very, very important. Dr. Uzeir Skaka is, he died a few years ago. He was speaking about hijama in Bosnia and Herzegovina because his family were traditional barbers. They were performing, and barbers were performing hijama, leech therapies. They were extracting tooth, performing circumcision because they were trained to do that. So 350 years of family practice, but Dr. Uzeir became a medical doctor and continue his tradition in doing that, all that treatments, but on in way of medical doctor. So this is tradition in Bosnia. This is overview in Bosnia. Thank you very much for your attention. And now closing remarks will give Dr. Nagi or Naji. Thank you.